Okay, everyone, it is 12:01. We like to be respectful of time here. So I want to welcome everyone to today's presentation. I want to say good afternoon to the East Coast folks that are on today's call, and good morning to those who are still in that time frame. My name is Kelly Leffler. I am a senior program specialist with AARP Massachusetts. I'm coming to you from Boston, Massachusetts. But it's really nice to see folks from across the country. I see somebody from California saying hello, and good morning from there. And happy opening day to those who celebrate the baseball season as well. So if you are coming to today's session, we are going to be focusing on making sense of caregiving costs and delving a little bit deeper into the AARP workbook for family caregivers, which everyone will receive a virtual copy of after today's presentation. If you've registered for the event, you'll get a copy of that workbook. And you can also order a physical copy to be mailed to you. That's also a possibility. Today's presentation will be recorded, so if you have to hop off before the end of the call, you will also receive that recording after the presentation, as well as a post-event survey. And we would really love for you to take just a few moments to fill out that quick survey so we know how we can improve future events. So we can go ahead and get started with today's presentation. We will be led by AARP volunteer Renee Senes, who will be taking us through making sense of those caregiving costs. So I'm going to hand it over to Renee and start our presentation.
Thank you, Kelly. Welcome, everybody. Apropos of nothing much than that all of you are coming from different areas of the country. I was recently traveling by van in the Southwest, and during our travels, we listened to an old classic by John Steinbeck called Travels with Charlie, Charlie being his standard poodle. So I highly recommend it if you're looking for something to listen to while you're doing your caregiving. And it also gives you a beautiful insight into our country. So welcome, everybody, on our presentation on the AARP Financial Workbook for Family Caregivers. Kelly, just let me know, please, do people have the workbook or they will be getting it after the presentation?
They will be getting it after the presentation.
Okay, so thank you so much. So we are referring to a workbook that you will be receiving. We're going to go through it kind of in broad brushstrokes so that you understand what it entails and the information that we're looking for. And we're going to introduce you to some essential information for caregivers. And it's our hope that it's going to be educational, informative, and it will help you to be confident about making your own plans, as well as better understanding how to plan for your care recipient. Next, please. As with all things, this is not legal advice. This is not financial advice. Your situation may be different. So please keep in mind that the presentation is intended for a general audience. And while I cannot provide specific advice or recommendations, hopefully the information we cover today will help you to make informed decisions. So do be sure to consult a professional for advice regarding your situation. Next. Being a caregiver is a labor of love that comes with a lot of responsibilities. While it's hard to put a price on caregiving, it also comes with some real out-of-pocket expenses for you. You may be picking up groceries, helping with housework, making trips to the doctor or the pharmacy. All these little things add up. And having a clear picture of what's involved, whether it's your care recipient's health, housing, or finances, lets you plan ahead and makes the juggling a little easier. And that's why AARP has developed the Financial Workbook for Family Caregivers. It's designed to help you focus on the financial aspects of your caregiving. We hope that these tools will help you feel prepared and it will help to minimize some of the stress you feel about making financial decisions. Note that we'll use the term care recipient and loved ones interchangeably throughout the presentation because, of course, both terms accurately describe the loved one you are providing care for. Next, please. In this session, we'll review how to use the financial workbook. We'll talk about how to incorporate practical financial tips into your caregiving, and we'll add resources to assist you. Couple of ground rules. Please remember to keep your microphone on mute. I will leave time for questions, so you can put your questions into the chat box, and Kelly will monitor them, please. Do remember that this is a public forum, so don't share personally identifying information. And please remember that this is also a judgment-free zone. All right, let's get started with the next slide, please. Did you know, next slide 5, please. Did you know that family caregivers are thought to be an invisible army? Without adequate support, they remain vulnerable to financial and job-related hardships, as well as emotional stress. So let's highlight some of the out-of-pocket costs associated with family caregiving. Did you know that in 2021, I think we need one more slide, Kelly. There you go. Did you know that in 2021, family caregivers spent an average of $7,242 on caregiving expenses, such as transportation and home modifications? So that's a significant amount of money out of pocket for caregivers. Next. These same caregivers spent 34 billion hours providing care to their loved ones. AARP's caregiving report to the U.S. in 2017 estimated that 48 million family caregivers in the United States provided 34 billion hours of unpaid care to adult loved ones. Next, please. What this all adds up to is $470 billion of unpaid care, significant amount of money. If we look at the next slide, you'll see a breakdown of these costs. How was all that money spent? More than 3 out of 4 caregivers incurred some, but not all, of these out-of-pocket costs. And why did they incur them? Love, yes, of course, but also because professional home care costs more. There's a company called Genworth that is one of the major providers of long-term care insurance. And in 2018, they estimated the average monthly costs for homemaker services, things like light housekeeping, meal prep, and running errands, at more than $4,000 a month. That's $48,000 a year. The cost for a home health aide, someone with medical training who can assist with bathing and other personal needs, added about $200 a month more. So as you can see, more than $50,000 a year if you were going to pay for this professionally. This is also very much dependent upon where you live. Kelly and I are talking to you from Massachusetts, more particularly from the Boston area. And in the Boston area, costs range anywhere from $22 an hour to $31 an hour. My mom, who recently passed away, had home care for about 3 years. She lived in Florida, and we worked through an agency. Florida costs came in still expensive, but came in under Massachusetts costs, closer to $20 to $21 an hour versus the $31 an hour in Boston. So these costs have consequences. If you look at our next slide, you'll see that many of these costs have consequences. Many people dip into their own retirement savings to help pay for caregiving costs. Many spend less a month on their own health care, and more than a third cut back on personal spending to get the extra money they needed to pay for a loved one. Part of what we're going to do today is look at what those costs are and help you look at your own costs as well as caregiver costs. Next slide, please. Slide 10. Kelly, can you move it to the next slide? There we go. So the next slide here is, my apologies, about 3 in 5 caregivers, almost 24 million people, have a paying job in addition to their caregiving responsibilities. More than half of the family caregivers have to take time off from their main job, reduce their hours at work, or even quit their jobs altogether to accommodate their responsibilities. This can mean diminished chances for promotion, less job security, fewer employment benefits, reduced money set aside for their own retirement, and lower Social Security benefits for themselves when the time comes. So what I wanted to share with you is a recent article from Investment News. Investment News is one of the publications that come out that is widely read by financial advisors. And the article is How Caregiving Costs Women Their Retirement Security. And Investment News reports that a woman in her 50s who gives up her career for elder care also gives up $324,000 in earnings and savings. And it says that the collateral damage of caregiving is the retirement of midlife women who are providing caregiving, who get significantly less percentage of Social Security and have 64% of them have paused on adding to their own retirement. So we're looking at a significant impact, particularly again on women who give up time in their lives to caregive for an elder parent. And then also the amount of money that they are cutting back in terms of their own personal savings. Next slide, please. So what can you do to safeguard your future? You can plan. This brings us to the bulk of today's discussion, the Financial Workbook for Family Caregivers. The first page says it all. Dear Family Caregiver. The guide was designed to help you and your caregiving journey by AARP and Jessica Allen. Jessica was a caregiver for her husband who was injured in active duty in the military. She's also an accredited financial advisor. And we recognize the toll that caregiving can take, so we have developed this set of tools to help you prepare. A few points to highlight here. First, the cost of caregiving is high, as we've just looked at. Families can spend close to $8,000 a year caring for our loved ones. Please take note of the piggy bank symbol throughout the guide. We've added these in so you could specifically point out and identify tips that could assist you with caregiving. Second, every caregiving journey is unique. There's no one size fits all. Your journey is yours, and there are no right or wrong answers, just your answers. You may be able to finish this guide in a day. It may take several days. It may take months. Whatever works for you is what works best. This presentation will simply hit the highlights in order to allow you to complete the guide more efficiently. Finally, and this is obviously a sensitive subject, but we know that caregiving can be stressful, especially over long periods of time. Remember, it's just as important to take care of yourself, both your physical and your mental health, as you look after a loved one. So please do that. Care for yourself, for you are the person that you're caring for cannot receive adequate care if you are not taking care of yourself, and all the people that care about you find that important. Next slide, please. Before we delve into the guide, Kelly's going to play a video for you. It's a clip from Facebook Live session that we did with the author and a general guide and a guide for military caregivers. Jessica Allen will explain the importance of this guide, especially if caregiving is suddenly thrust upon you, as it was with her when her husband was injured on active duty in the military. So want to play the slide for us, please, Kelly?
Yes, and just give me 1 second to make sure I'm optimizing this for video. And here we go.
If you had a guide like this, you could start working on these things. You don't have to complete it all in one session, but the way we set the guide up is where you could come in and say, okay, today I'm going to work on this section. And then tomorrow, while you have that time, you can. And then before you know it, it's done. But the most important part about this guide was if something happens and you have to step away, you go on vacation, you take some respite, maybe you're sick, you can give this guide to someone to step in for you. And it's going to tell them, hey, his, powers of attorney are located here. Hey, his care team is here. This is the doctor so-and-so does this. Oh, I'm out of colostomy bags. This is who I contact for that. Like, that's the whole purpose of this guide, is so you can pass it off and breathe for just a minute. So
Yeah.
it may take you a while, but it's worth it in the end.
Okay, thank you. And I like that.
Guide like this.
I like that you can pass it off and just breathe. That's all about, again, taking care of yourself. So today we're going to provide financial tips within 4 categories: health, housing, money, and future. Remember, personal finance is called personal for a reason. There's no one size fits all. This guide is designed to help you prepare for your caregiver financial life in more specific detail. After you complete the guide, it can be a key resource to help equip someone to step in the event of your absence. Also, we strongly suggest you seek advice from professionals. For example, once you complete your power of attorney, will, and burial plans, seek the guidance of an attorney. Once you list your debts, perhaps you should seek an accredited financial counselor to help you with a debt management plan. The guide is designed to help you through this process, not to replace trusted professional advice. Next, please. Let's walk through the healthcare section of the guide, where we're going to begin documenting plans for the healthcare of your loved ones. We'll cover a wide range of topics, including health, sickness, and even death. These topics can be very difficult to discuss, but it's vital to make the right plans for yourself and those you provide care for. Before you begin filling out each section, you'll want to take time to gather your key information that will help you complete it. For example, before completing the healthcare team section, collect all of the contact information for your care recipients' doctors, hospitals, and pharmacies. Next, please. Let's start with the healthcare plan, which begins on page 5 of the guide. You'll want to answer some very important questions about the healthcare your loved ones received. First, where does your recipient receive care and from whom? Do they use Medicare? If they're a veteran, what about the VA? Do they have private insurance? Make sure that you take the time to understand not only who the insurer is, but learn about their caps, co-pays, deductibles, and most importantly, their coverage. On the next page of the guide, you'll list health issues, medications, and accommodations. This page can be extremely helpful at any and all doctor's appointments and hospital visits. Emergency contacts are a must for any caregiver. Who can step in for you with a little notice? Hopefully, you have more than one person who can jump in. And what other details can you add to this page to help medical staff with your care recipient? Does your care recipient have allergies that the medical staff need to be aware of? Do they have difficulty hearing or seeing? Do they live with memory loss or dementia? If you filled in the accommodations above, add those details to the last area as well. Next page. As a caregiver, oftentimes you may feel alone, but you're not. Make caregiving a team sport. In this section, you'll document all the necessary contact information, such as names, addresses, phone numbers, email addresses, and websites. Your care recipient's care team should know you and consider you, the caregiver, as one of the most valuable team players. You can provide medical professionals with crucial information that can make a big difference in treatment. And caregivers can also provide details that the care recipient forgot or perhaps didn't notice. You might also want to check if your state or the state where your loved one resides and gets medical care has passed a version of the CARE Act. The CARE Act makes sure caregivers are recognized when their loved ones go into the hospital, notified when the patient will be released, and given instructions they need for continued care before their loved one returns home. You can even go to aarp.org/wallet cards and download your free CARE Act wallet card for yourself and your loved one. It contains information on the CARE Act in your state. Fold the cards, wrap around your insurance card, and place them in your wallet. Next slide, please. Let's think about the other members of your healthcare team. Do health aides visit the house? Do you have a secondary caregiver that steps in so you can take a break or simply run to the grocery store? Who is there that can step in short notice? Are you a member of a church or a community-based club? Could a member of one of those organizations assist you? Do you have someone to chat with from time to time about the stresses of being a caregiver? You can list any and all of these people in this section of the guide. We'll provide you with information on some resources that can assist you later in the presentation, but I would like to mention two things that can really help when you do need to take a break. Respite care. Respite care is a short break from regular caregiving duties. As we said, caring for a loved one is stressful, and it can have real consequences on the physical and mental health of the caregiver. A 2015 National Caregiving Survey by AARP found that 85% of caregivers said they would find respite helpful. Sadly, access to respite is limited by location, income, and health condition of your loved ones. One of the links we'll give you later will contain information that might help you find respite care in your area. Adult daycare programs can also provide caregivers with a needed break, while giving older adults a chance to socialize with their peers and remedy the isolation and loneliness that many experience. The programs they provide and the costs associated with them can vary, but your local area agency on aging can help with information. You'll be able to find your local agency, again, through the links that we will provide later. So I'm going to stop right here, see if we have any questions on healthcare before we move on.
And I don't see any questions in the chat. I do want to send that to reminder to participants that if you have any questions, please feel free to put them either in the chat or in the Q&A. I'll be monitoring both of them. And we can give it just a couple seconds to see if any questions pop in. But I think right now everyone is set, but please remember to put those questions into chat, and we'll stop again at the end of the presentation.
Okay, so we'll move on to the next slide, power of attorney on slide 18. Okay, so we move on to more of the legal issues that come with caregiving. And this one is a significant and important document. A power of attorney, or POA, is a signed document in which the person appoints someone else to act on his or her behalf. A power of attorney can be limited to a specific purpose. Maybe if you've ever had a real estate transaction and you couldn't be there, you gave power of attorney to an attorney to sign the closing documents for you. Or they can be very general and cover all financial matters. State laws on power of attorneys vary, so be sure to know the law wherever you and your caregiver, your care recipient reside. As I said, I live in Massachusetts and my mom lived in Florida. So we had to be cognizant of the fact that her power of attorney was a Florida document. Also keep in mind that the guide only provides a worksheet. Filling it out is not a legal power of attorney. So once you have completed the worksheet, you still need to seek out a legal professional to draft a document for you. The power of attorney must be notarized in order for it to be binding, and the person signing the power of attorney has to be mentally competent or deemed mentally competent at the time of the signing. And that's something that the attorney will decide at the time of the signing, and you will also have witnesses. There are also powers of attorney that provide for financial and for healthcare issues. You can name multiple people or different people to act as power of attorney for you, but I would not name co-power of attorneys. That can get really, really cumbersome. So what I want you to look at is, when you're going through all of this, is where your care recipient and where you Have investments. If you're going to be having investments at a different brokerage house, let's say at a Fidelity or a Vanguard, and you have bank accounts at Bank of America or Santander or Wells Fargo Bank, you might want to check with each of the financial institutions as to whether or not they have a power of attorney specific to their institutions and complete those as well. So many, as I said, many facilities will require their own power of attorney. So I start with saying have a generalized power of attorney and then check with the institutions to see if they have a one specific to their own establishment. Don't name someone as a generalized power of attorney and give a power of attorney at a bank to somebody else. Those are going to conflict with each other. Try to have some continuity and consistency. Once you have your power of attorney completed, make sure that you store it somewhere where it is safe. My best suggestion for a power of attorney is that you leave it with the attorney who drafted it for you, and that you have a copy of it someplace safe, either in a, not a safe deposit box, a file cabinet, a locked file cabinet, where it can be protected from fire, theft, or flood with a notification that the original is stored with your attorney. Give a copy to the person you are designating and encourage them to put their copy in a safe place. If you are inclined to use a safe deposit at a bank, make sure that someone else has a key and also signature authority on that safe deposit box. Otherwise, they will not be able to get into it if you can't. Next slide, please. Other legal documents that are very, very important are a will or other estate planning documents such as a trust. This can be a sensitive topic. It can also be very emotional, but it's important that you take the time to complete these documents as well. They become your voice after passing. People reading these documents will be grieving your loss, but the information you provide can actually help them with their grief. If you take the time to list out what you want to happen, it takes the guesswork out of it for them, can greatly reduce your beneficiary's stress during a very difficult time. Also, just like the power of attorney pages, these questions need to be applied to both your care recipient and to you. And of course, separately, the answers are not going to be the same. You might be thinking that you yourself don't have an estate. However, each one of us does have an estate. It might be just a few bank accounts, a pet, a car, some material goods. But once you pass, someone has to take care of all of this. And if you have minor children, you'll definitely want to complete the will and/or estate process as soon as possible. Just like the power of attorney, completing these documents is not a legal will. It is not binding. Some courts might take it into consideration about these being your wishes, but it is in your best interest to make sure that these documents are completed by an attorney. And again, the person who is going to be signing the document in the presence of a notary and witnesses is going to have the legal capacity in order to be able to do this. Next document, next slide, please. And finally, we're going to dive into yet again a difficult topic, making sure that your final wishes are known and documented. And this is talking about, providing for an interment plan or cremation. This does not go in your will. Your will may not be read until after you have died or after your care recipient has passed away. So it is important to have documentation about what your wishes are and to spare these people from making difficult decisions after you have passed. And, my mom had actually done this. My dad died many, many years ago. And after working with her to plan my dad's funeral, she actually prepaid her own funeral. And this was such a stress reliever for me. She had made all her arrangements in Florida, which included flying her up to New York and being buried in New York. And the funeral home in Florida took care of everything seamlessly. I didn't have to worry about making airline arrangements or knowing who was going to pick her up at home. and transport her. And once she got to New York, the funeral up here took care of everything from this end. So I strongly encourage you to make these advanced decisions, document them. If you're in a financial position to do so, perhaps even prepay for them, and talk with your care recipient about what he or she would like to have done. Are there savings to cover burial costs? Is there life insurance to cover costs? Don't leave expenses to your loved one to take care of. Plan ahead so they can focus on grieving and settling your affairs. All right, I'm going to stop right there too, and just take a couple of quick questions if we have any, or comments if we have any, about the legal issues before we move on.
Sure. So we had a comment that said, how to select the correct facility, licensed with oversight, transparent on charges and fees, security, transportation. So how to select the correct facility, caregiving resources in my state, resources is not easily available anywhere as before. And don't mean,
I think maybe that's going to come in at the end on the AARP caregiving. There are also caregiving organizations. I don't know if that's in the end of our, and people who are accredited as caregiver sort of oversight coordinators. So, and I would also check with your councils on aging. That's what they're called in Massachusetts. They're usually pretty well versed on who's in the area, who's reliable and who's not.
thanks, Renee. And then we had a great suggestion in the chat. Many states have the blank power of attorney documents available on the state attorney general's website. So depending on what state you're in, check that website and they may have the blank document available.
Wonderful suggestion. Remember, again, it's not legal until it is signed, witnessed, and notarized. So while I like blank documents, I also like attorneys. And, it would be my preference on any will. There are sites that will also do wills on any will or power of attorney on a legal document of this significance. I think it's well worth your while to consult with an attorney.
Just 1 second, I'm answering a private one. All right. Okay, with that, I don't see any other questions or suggestions in the chat, so I will pull the presentation back up.
Thank you. All right, so having dealt with some of the finances and some of the legal issues, which are kind of some of the hard part for many people to talk about, we're going to move on to topics that affect your day-to-day life. And we're going to start with issues related to housing and life at the home of your care recipient. We'll also discuss transportation, which is incredibly important to think about to enable your recipient to live in their home and community as long as they choose, and for you to provide the best care for them. We'll also talk about diet and allergies, and then we'll riffle through the filing cabinet. Next slide. This section is intended to help you and your loved one get their home in order. If you live separately from your caregiver recipient, you might want to take the time to fill out the pages for yourself as well, so that in the event that you eventually need caregiving, this information will be in place. Make sure you list due dates, amounts due, where the payment goes, and other vital information. You won't want to miss or be late on a payment, so make sure you do this for all the bills related to your care recipient remaining in their home: the mortgage or rent, the homeowners or rental insurance, the property taxes, and all of the household utilities. So on a personal note, I thought I had this nailed. I'm the financial planner in the family. I thought for my mom, I knew all of this. Everything was going along smoothly. Mom, as I said, sadly passed away in December. And I suddenly learned that while many of her bills were on automatic payment, they were all coming out of different places. So the HOA fees for her condo came out of her credit card. The Florida Light and Power bill came out of one checking account, and the Comcast Xfinity cable bill came out of another checking account. And I was busy juggling, trying to figure out where everything goes. So if you're going to set these up, or if you're looking at these now, try and consolidate. Try and pick one account where if you're going to do automatic payments, that's where they're going. Maybe it's the account where the Social Security payment comes in. So there's money constantly covering it every month and bills going out every month, but get it organized. It will make life a lot easier for you. And budget billing is available with most utility companies. So if you're looking at an electric bill and the electric bill is incredibly high in the winter because that's how heat is paid for, or the oil bill is incredibly high in the winter, you may be able to talk about budget billing with these companies, which will take your average yearly bill and divide it into 12 months so that the bill is consistent every solitary month. And that can make it a lot easier for you to keep track of bills rather than having a massive bill in December, January, and February, and then nothing over the summer. So don't be afraid also to ask for discounts. There might be a military discount or other discounts because of organizations like AARP that you belong to. Also check to see if your state has a tax-free or reduced property tax exclusion for your care recipient. That can save you thousands of dollars, and that's usually a phone call to the tax assessor in your town or city. Ask also for discounts on homeowners and rental insurance policies as well. Again, we're looking at you doing a lot of legwork, but ultimately it will make your life a lot easier and can save a significant amount of money. Moving on to transportation. Access to transportation can be a very important factor in your care recipient remaining in their home. Can your care recipient still own, operate, and drive a vehicle? If so, use these pages to list all of the information needed to own and operate a vehicle in your area. If you're the only driver, use these pages to help fill out the information for yourself. Make sure you check with your local county clerk's office and see if your care recipient is eligible for any discounts or tax exclusions. For example, Purple Heart recipients in the state of Tennessee can receive 2 free license plates. These free license plates can save hundreds of dollars a year, and many other states offer similar benefits. Some states require automobile owners to pay property taxes on their vehicles. Massachusetts is one of those. We call them excise taxes. And in fact, it's a property tax on your vehicle. So make sure you know if that's the case in the state where your care recipient resides. Also, ask for discounts on vehicle insurance and public transportation. My mom still had a car, and she wasn't driving it, but her caregiver was driving it. And one day it sort of dawned on me that we needed to check in with the insurance company and make sure that Felicia was also insured. So ultimately, we talked with the insurance company, and we had Felicia added to my mom's insurance. Felicia, of course, was covered under her own insurance, but we wanted her under mom's insurance as well, since it turned out that she really was becoming the primary driver of that car. So look at who's driving the care recipient's car and make sure that they are covered. Next slide, please. Special diets and allergies. So do you or your care recipient have a special diet? Do either of you have any food allergies? Use this page and list those out. Also, this can serve as a shopping list, especially if there are dietary items that you need to buy every week. Is there an EpiPen that your loved one has? You'll want to list the expiration date for the EpiPen. Jot this in the other column or the special equipment category. Next slide, please. Keeping documents safe and secure is a necessity. And to do that, you might consider getting a home safe or a locked file cabinet. The contents of every safe will look different. We will all have different vital documents. So the list here is simply to get you started. You can always add different types of documents to your own list, and some of the documents listed may not be relevant to you at all. If you don't have a safe and need to purchase one, make sure it's able to withstand fire. Also make sure it locks and you put the key in a secure location, and remember where you put it. You might even consider getting a safe with 2 keys to keep each set separate in a separate household for safekeeping. Make sure you use that lock. Locking your safe or file cabinet provides one more level of protection from identity theft. And if you're thinking, as we talked about, of getting a safe deposit at a local bank, make sure that you have someone else has a key and someone else is designated as a signer. Otherwise, the bank is going to have to get that safe deposit box drilled in order for someone else to get access to it. Next one. So like a safe content, like I said, you might also want to get a file, a safe file box to get started on organizing your files. And I ended up doing this every time I would go visit my mom in Florida. I noticed that, bank statements were piling up and notifications from insurance companies were piling up. So I went to Staples and I bought, the 3-tab file folders. And I just started making files for all of her documents and putting them into file cabinets, alphabetizing them, of course. And that way it made it easy to go back and find things. So when she got, something from Medicare, or she got something from her supplemental health insurance, all of those went into the file cabinet. I put her monthly statements in there from her bank accounts and her brokerage accounts. And ultimately, it ended up being much easier for me to manage things on her behalf because I wasn't wading through piles of documents. I had everything pretty well organized. So make sure again that there's an extra set of keys for that file cabinet. All right, next page, money, my favorite topic. So one of the most important responsibilities as a caregiver is planning and managing money, both your own and the care recipients. Home is where most of us spend the majority of our time, and it's important to make sure that the home is a low-stress environment. Though difficult, discussing money doesn't have to be stressful. By taking the time to make your dollars work for you and your care recipient, you can create peace of mind that will help make your time at home more enjoyable. In this section, we're going to discuss budgets, investments, and debt. Next slide, please. The first budget page is for you, the caregiver. If you're married to your care recipient, you're going to want to combine budgets. It's vital you give every dollar in your home a name. Tracking your dollars actually enables you to control your money. One page is probably not big enough to list every single dollar. You can group your expenses into the categories provided. Anything that doesn't fit into the lines exactly can simply be added to the discretionary expenses category. However, if you want to be more precise, take the time to list your expenses out individually on a separate piece of paper. There is not one way of budgeting that works for everyone. You might like using a pen and paper. You might like an app that you have on your phone. You also might like to set up a spreadsheet, or you could use one of the many budgeting websites that are available on the internet. The point of all of this is to achieve what's called a zero-based budget. That means you have $0 left after you name every dollar. We have a college savings line on our form, so if you don't need to be saving for college someone, scratch it out and make it your line for savings. Make this budget all about you. AARP offers a free online tool to help you set up your budget using the AARP Home Budget Calculator. Next slide, please. We've added a caregiving budget because we realize there are specific expenses relating to caregivers. As we've discussed, caregivers spend thousands of dollars a year caring for others. Take the time to list out your caregiving expenses separately from the budget that you've put together for your personal finances. We also have a sheet to prepare a budget for your care recipient. Remember that unless your care recipient is your spouse and you've done a combined budget, this budget is different than the one you filled out for yourself. Apply the same thoughts from your budget to your care recipient's budget. If possible, and your care recipient is still competent and cognizant, they should be involved in this budgeting process. There may be things that they're spending in cash. They may be going to the beauty salon to get their hair done or to get a manicure. These kinds of, and they're giving a tip to the person who's providing this service. If that's the case, make sure you know what this is and how much this is costing them on a given month. List it all out and make sure you know where the money's coming from. Of course, we've talked about, what's going out. We need to, of course, talk about what's coming in. So you're going to be listing where is their income coming from: Social Security, a pension, an annuity, and perhaps income from investments that they might have. So we're going to move on to talking about investments. Next slide, please. So if you personally or your care recipient has investments, this is where you can determine whether or not those investments adequately meet their needs at this point in time. And this is where a financial professional comes in. This is where that power of attorney also comes in. Spend the time researching investment companies, decide what's best for you, ask about fees and commissions, find out if they are acting as a fiduciary, which is someone who manages money. And it should go without saying, you want to be sure that you're making more money than you're paying out in fees and costs. The AARP Interview and Advisor Tool is a free resource to help you understand a financial advisor's credentials, compensation, and tips on how to get the conversation started around needs. This tool is available for a smartphone, a tablet, or a computer. Next, please. Our debt page provides you with a simple template so you can begin organizing your debts and create a get out of debt action plan. Being in debt is not a bad thing. Most Americans make payments for a house, a car, student loans, credit cards. The problem isn't the debt, it's the interest rate. The original debt that started out can easily double or triple if you're not careful. The debt system in our country favors the creditor, not you, the consumer. Being debt-free can offer you some additional financial freedom and peace. There are numerous ways to eliminate your debt. Most financial experts recommend organizing your debt from smallest to greatest. You can also pay minimums on the bigger debts and then take your available dollars to eliminate your smaller debts. As you knock out your smaller debts, you're going to feel empowered to attack the next set of debts. You may need, again, professional assistance with organizing your debts. You may have someone at the bank who can help you, or you can search for an accredited financial counselor known as an AFC. Many AFCs will even meet with you or online or over the phone, so don't be afraid to ask for help. Check out AARP Money Map, which is going to give you some additional financial strategies that can be customized to help you. And I can't stress strongly enough that if you are managing finances for someone else, it's going to be imperative that you have that power of attorney in place. Otherwise, many organizations will not even be able to speak with you. Next page, next slide, please. All right, turning to something that's important to you, the loved one you care for, and everyone in your family, the future. What does your future look like, and what are your goals? Do you need additional education? Do you have a retirement plan? Do you need to save more for retirement? How might your caregiving responsibilities impact your plans? It's important for you to thoughtfully consider all of these questions and to speak with the care recipient about what they want for their future as well. Use the information from the financial section to evaluate your options. We've included a page for the caregiver as well as for the care recipient. These plans could be similar or they could be vastly different. Next page. So please take the time to check out our resources and key terms pages. We've listed some amazing nonprofit organizations and governmental agencies that can assist you and your care recipient, as well as some terms you may encounter while acting as a caregiver. We've also got a place where you can jot down some additional notes if it's helpful to you. Next. And speaking of resources, and you will get this information, we wanted to give you a few before we wrap up. So you will get a version of this in the workbook, and feel free to share it with a friend. Both are available online in a PDF version if you would prefer that and find it easier to download. And then last slide, please. AARP and other organizations have many resources to help you. We've listed a number of them here, as well as in the back of your workbook. We also have a caregiving resource center and a family caregiver support line, both in English and Spanish, to help you with tips, tools, and resources. Our Prepare to Care guide is available and will be given to you at the end of this presentation. And if you're interested, we welcome you to join AARP's Family Caregivers discussion group on Facebook to get support during your family caregiver journey. You do not need to be an AARP member to join the group. And finally, and this is a sensitive sensitive subject, we know that caregiving is stressful, especially over long periods of time. So we've included the National Suicide Prevention Lifeline. The Lifeline has a staff 24 hours a day, 7 days a week, every day of the year for talk and support if things are getting too difficult and if you're feeling overwhelmed. So if you are having suicidal thoughts or thinking about hurting yourself or the person you're caregiving, please reach out by calling 800-273-8255. Make a note of this number and have it accessible for yourself and your loved ones. So I'm going to open this up to some questions for you on the financial tips that we've reviewed. Also, anything you wish to share. Some of you are already caregiving and may have tips that would be beneficial to everybody who is attending. So Kelly, any other questions that we have at this point in time?
We have some comments that have come into the chat. So one of which being auto billing is convenient. Power of attorney needs access to person's email and cell phone in the event the biller sends notification that billing is delinquent or expired credit card and funding source is depleted.
So let me just stop you right there, Kelly. That is a great suggestion, and one I also again found with my mom. My mom's, as I said, some of her bills were going to a credit card, and the credit card had a very, very outdated cell phone number. So when I tried to change the login, they were sending login information to her old cell phone, which of course she was never using and I didn't have access to. So yes, make sure you get those emails, you get the cell phone number, that you get everything updated so that that two-step verification code is going to a current and existing cell phone.
Thanks, Renee. We did have a quick question. Someone said they were late coming in. Will the slides be available to participants? Yes. So after today's presentation, everyone who registered will be receiving a copy of the slides. You'll be receiving a recording of today's presentation, and of course, you'll always be receiving the workbook itself so that you can start putting in this work and doing these exercises. So you'll receive all of that. And in addition, you'll receive a quick survey to fill out so that we know how we can improve future events. Somebody noted that the national suicide number is now 988. Thank you very much for noting that. I will confirm and make sure that the AARP staff know that so that they can change the presentation. And we'll do that on our end as well. Thank you. Any other questions? We've got kind of a quiet group today. I know there's a lot of information to soak in. Here we go. Here are some coming in. So, how best to effectuate moving person with dementia from a home to a care facility? Do you have any tips on that?
How best to effectuate? I mean, I would start by visiting the care facilities. You can get a really good feel for whether or not you think that this is someplace you'd like your care recipient to be, simply by walking in the front door, seeing what if the staff is attentive, who's there. There are also organizations that rank retirement homes, nursing homes in your area. So make sure you get on those. Look for whether or not there have been any complaints filed with the Attorney General's office regarding this facility. And again, there are caregiver coordinators who, I mean, you can pay somebody to do this on your behalf, but certainly I would take the time to go to these different facilities, take a tour, talk to somebody, show up kind of unannounced at an odd hour, and just see what's going on.
And then there was a question on, can we request the book be mailed? Yes, you can make that request. So when you get the digital copy, of course, you always have the option to print it, but you can also request a copy from AARP. You should be able to do that online. Another question, how does long-term care insurance fit into all of this? It's difficult to understand what it covers and how and when to access, or does AARP offer a separate session on this?
But that's a really good question. And my mom was in fact fortunate enough to have long-term care insurance. So yes, long-term care insurance absolutely does fit in. If you have it, get the policy and read the policy. It will tell you very clearly whether or not it covers home health care, or whether or not it only covers home health, or whether or not it only covers nursing home care. In Massachusetts, current policies are mandated to cover home health care. And there's usually what's called an elimination or a waiting period. And the person must be unable to perform several activities, 5 out of 7, 4 out of 6, what are called activities of daily living, feeding themselves, toileting, transferring, and or Alzheimer's and dementia. So yes, get the policy, read it, call the long-term care insurer, and find out if the person has insurance. Will it cover home health care? And how do you, and also, does it cover a family member providing care? Some policies, you have to be a professional caregiver. It's got to go through an agency. So find out all about that, and then find out how to put in a claim, and you may well be able to get some coverage for this.
And the latter half of that question was, does AARP offer a separate session on this? Not that I'm aware of, at least not at the at our state level. There might be some things at the national level, but I did just put into the chat an AARP webpage that's all about long-term care, and it really covers a lot of those insurance questions. So I would take a look at that as well. And then a follow-up, my dad paid for long-term insurance for years, but he had to be in long-term for 3 months before it kicked in. So when we went from assisted living to a nursing home for his last week of life, they didn't cover him.
And that's true, although some long-term care policies and unfortunately also cover assisted living. So it's and we can't unwind this, but again, make sure you read the policy and you know what it covers. Does it cover home health care? Does it cover assisted living? And does it cover nursing home? And there is always a waiting period. It can be anywhere from 90 days, usually 60 days to 180 days, depending upon what you've chosen for the policy.
Thank you. I'm not seeing any other questions rolling in, but please, if you're typing, don't stop now. If I see something pop up, we can get to it. But I did want to thank everyone for being here with us today. I know that this can be a complicated and certainly a heavy topic, but hopefully some of these resources can help you to kind of untangle some of those strands, and that the workbook can be of assistance for you moving forward on this journey. So I also want to give a very special thank you to Renee for guiding us through today's conversation. And please, once again, I will be sending out all of these resources. So please take your time and take a look at them. And we hope to see you soon at another AARP virtual event.
Well, thank you everyone for attending, and my best wishes to you as you go along your caregiving journey. I know how difficult it can be.
And you know what, just as we're hopping off, there was one more question that did come in. How important is it to have an elder law firm review last wills and documents, powers of attorney, etc.?
So some attorneys are specialists in elder care, and there is a elder law website that will tell you, who is certified. I think any good, competent estate planning attorney can write a will, a trust, a durable power of attorney, and a healthcare proxy. But elder attorneys, everybody has an area of specialty, just like, attorney who specializes in divorce may be more aware of some of the nuances of that than an attorney who does real estate transactions. So yes, an elder law attorney is a wonderful resource. And they're usually also very familiar with the different care facilities in the area and the people who are providing support services.
All right. And I don't see any more questions at this time, just a lot of thank yous and folks that are looking forward to receiving the workbook. So we do want to be respectful of time as it is 1 p.m. Thank you again so much, everyone, for joining us today, and have a great rest of spring as we move into this new season. Thanks, everyone.
Bye, everyone.